Good morning. Good morning, good morning, good morning. Hello. I'm going to wait for a couple people to join in so we can start with Whitman-Walker. Hello, hello, hello. Good morning, children, grandchildren. All right, I think we got them. Hey, Whitman-Walker. Good morning. Let me move back now that I'm Orlando Machuca Jr. Thank you for having me. So we're going to wait a little bit to see people join in. I'm not going to wave at everyone because I don't have that time. Hello, Soul. Good to see you. Welcome. All right. Come on. Come talk to me. We are here live talking about sex. Talking about how to bring up the conversation, how to be comfortable talking to partners, relationships, and better yet, strangers, because, we sometimes are that person who could have strangers, and we need to have those conversations. So it's very important to talk about sex, talk about health, talk about information you don't know. If you have questions, there's always someone out there to help you understand situations and how things work, where to find information in your community. Remember, not everyone has access to community information, so that's why I'm here. Hopefully I can touch someone who's never been informed or has information on these topics. So again, let me introduce myself. I am Orlando Machuca Jr. I am a DMV socialite. I teach in the area. I'm a dance instructor, salsa, bachata, Latin music. You've probably seen me around the area. I teach at the Salsa Room, Cafe Citron, your local parties. And now my newest journey, I've joined up with the Whitman-Walker Health as an employee and a social media influencer to help spread information on HIV, AIDS, STIs, protection, prevention, and how to be informed on things that you might be questioning, something you may not know about, something you, always wondered and you're not comfortable asking. So if it's something you don't want to ask here and you're just really shy, go to whitman-walker.org and you can send an email. There's phone numbers you can reach and people you can contact in order to be informed. All right. So let's get to the point. Give me a second. I'm thirsty. All this talking. So today's conversation is mostly just how to be comfortable. One, I would say loving yourself because you matter. You are number one. So always make sure in situations where sex is involved, we are, always asking and making sure that our health is not at risk. So you want to see, hey, how do I bring up a conversation about safe sex? Safe sex is very important. In a relationship, it's a lot easier to, have a conversation because you're with someone. It's more, of a thing that you're going to be with someone. But even at that, if you are not comfortable, if you're insecure, if you have doubts, there's always ways to just talk about, reach out for information. And Whitman-Walker is super good about helping, answer questions, and of course, testing. You always want to get tested. So HIV testing, STI testing, whatever you can get your hands on, do it, every 3 to 6 months, especially if you're very sexually active. But again, in my community, I like to dance, I like to go out, I like to drink, I like to meet people, and there's always situations where we get into I don't want to talk about it. It's just going to be one time. So it's very important that we take care of ourselves and we ask questions. And if they have a problem with that, then maybe it's not something you should be getting involved with. All right. So let's get started. Let's see. So what are good ways to ask someone? I mean, I just be direct. I'm a very direct person. Be like, hey, have you been tested? When was the last time you got tested? Depending on the reaction, you're going to understand, well, maybe they are interested. Maybe they just want to have fun, especially one night stands. You want to be very careful. And informed. So anyone on here have questions? I mean, it's not just about me talking. Well, it is. But I want you guys to join in. What are some situations you might want to bring up, or some stories you've had and experienced that maybe we can shed some light to? Let's see what I got here. Okay, let's see. We have a question. Let's scroll down. How a touch of Tule asked, how has being direct worked for you? Well, it's gotten directly to the point. I mean, if it's something that I want and I'm direct and they say, oh no, well, I don't feel like it, well, we'll just leave it at that. I mean, it's an easy way to find out right away, hey, is this something they're okay with? Are they okay with protection? If they are, great. I mean, let's be sex positive here. People love to have sex. We're not going to take that away from people. But being vocal about your health and your safety matters more than, a quick one night stand. So I think it's very important. Thank you. Thank you for asking a question. A touch of Tule. I think that's what her name is. Okay. Got it. I love it. Thank you for the question. Anybody else have a question on here? I got all these waves. Hi, Facebook. You guys are quiet over there. Let's see. Okay, so let's talk about a couple more situations. Let's see. Don't forget, a lot of people are very narrow-minded when it comes to, being infected, and they're very, oh, it's HIV, and I use PrEP. Yes, PrEP is very good for HIV and preventing it, but remember, there are way, 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 way more other STIs that you don't even know about, and thinking that they're not as important is very cautious. I want you guys to be very cautious about being able to know that it's not just about HIV. It's not just about, herpes. There's so many more things. For example, chlamydia, gonorrhea, syphilis. A lot of these things, can be treated, but still going through the process of all these situations, it's very stressful, on your mind, on your health. Oh, nobody will like me if, we got to get that out of our head now and talk about having safe sex. Safe sex is important. And if it's not important to you, then just get some information on it. Get some information, talk to someone. I know a lot of our friends and family members don't like touching that subject when it comes to these situations. So sometimes we do have to go out and get informed ourselves. All right, especially in a dance community. We meet people all the time. We're dancing with people all the time. And we don't know. We don't know. You can't tell somebody has an STI. You can't tell somebody is positive. You can't tell, anything from looking at a person. So it's very important for you to care about you, your health, and making sure you're there to take care of your loved ones, your kids, your families. Because if you are not 100%, guess what? You won't be able to take care of anyone else if you aren't healthy. All right? So remember that. Let's see if we have any more questions. And yes, definitely due to stigma. So guys, I mean, if it's something that, you hear a friend say, and I know we kind of blow things off with people when they're talking about, oh, that person is, stop it. Stop that. Let them know, hey, no one wants to be like this. Nobody wants to be infected. It happens, by methods that are out of our control. Not everyone gets infected by sex. Not everyone is a slut because they've been infected. No, unfortunately not. Some people, get injected by needles by accident. Some people get it from birth. Like, kids are born with this a lot, and we can't blame them and assume, oh, well, because someone is infected, that's their fault. It's not always someone's fault. Cheating partners. As much as you love your partners out there, I mean, I need you guys to be realistic. Babe, you're faithful? We're still, we're still getting tested every couple of, I think the thing dropped. Go check the, sorry, will be. I'm still here. Just look at me. Get tested. Let them know. You never know. You never know a situation. Someone gets drugged. Somebody gets roofied. They don't even know what happened, and somehow, somewhere, things happen. So, never, maybe, nobody knows. But we don't make these assumptions, and we always take care of ourselves, right? Um, One thing that really like irks me is like the whole, getting drugged, getting roofied. It's very important to, just like when you walk in the dark at night, have a buddy system. Anytime you go out and hey, I want to go get drunk tonight, have a buddy system. Hey, buddy, make sure you come out with me. If you see me getting super freaky on someone, hey, watch me, make sure I don't leave with anyone. It's very easy to get influenced by people, by alcohol, which leads to other things. And it's very easy to not even worry about things like that. So always have a plan. If you know you want to get drunk, make sure you take a friend with you and make sure your friend knows where you are at all times, because unfortunately, we never know what kind of situations may arise. There are dangerous people out there who try to affect people, who try to hurt people because they've been hurt. And hopefully, by talking about sex, by talking about situations where we can put a light that has been dark so much to a place where, hey, wow, it's not like it used to be, right? Let's see. Give me 1 second. We're going to check on more questions. All right. I heard some people look to be positive due to searching a community to belong to. Yes, a lot of people out there are actually looking to sleep with positive people because they want to feel like they belong. And it's very, they're looking to be accepted. They're looking to be accepted. They're like, hey, this person's been through a situation and I want to be through that situation. And we can't judge them. They want to be accepted. They want to be loved. They want to feel like, hey, well, maybe if I do this or if I get this, I'll be accepted by these people. And no, 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 no. It's a lot harder than that. It's more than just being accepted. You don't know how your body's going to take this strain. You don't know if your body's going to be able to control this strain. You have to be treated. You have to take medication. If you don't know that it's a big process to stay healthy and to stay informed, you need to be very careful with your body because not everyone takes it the same way. Some people live years without medication, they're fine. Others, dramatically get ill. And that's where we go from, HIV to AIDS. Once your T cells are down a certain count, it's hard because people are not sure about their bodies. No one knows how their body is going to take something. So we always want to make sure and be super healthy, be super informed, and, yes, have sex. People love sex, but be very safe. Be safe. These days, all these new, things are popping up out of nowhere, and you don't know what it could be. You may not know what it is. Look where, HIV and AIDS tracked back in the day, where we are lucky. We are able to say, hey, okay, this is what it is. Let's take, a pill a day, and hey, you're fine. You'll live forever. You'll live a long time. Back in the day, they didn't even know what it was. So can you imagine being in a situation where you get sick? Nobody can tell you what it is. No one can help understand what's going on with you, and you have no option but the worst you can possibly think of, which is death. So we need to be very careful because we don't know what's going to come out in the next couple of decades. We don't know what kind of things can happen. All we know is that the more we take care of our bodies, our minds, our health, the easier it is for us to live a longer life and be there for our loved ones. Let's see. Hello, everyone. Any tips if the combo seems super awkward? I mean, if someone has that much energy to be awkward with you in a situation where you're trying to be safe for your own benefit, I mean, I would just nip it in the butt. I'm like, you know what? It's not that serious. my life is way more important than a hookup. All right. Because obviously, if someone in a relationship is not going to get offended, awkward, because if you want to be with me, then we're going to be together. But it's very important for us to be super, super, super informed, be upfront. If, that conversation makes that go nowhere, then guess what? Next. All right. Let's see. We all want to be accepted. We sure do. If you want to be accepted, hit me up. I accept you. I accept everyone. Come take some salsa and bachata lessons with me. Let's see. All right. HIV treatment has definitely come a long way, for sure. Can you imagine? I mean, like when I was in high school, I totally joined a program where I would go around and teach middle school kids on HIV prevention and protection. And we had stories of people who, they were not sexual. One time something happened and boom, they didn't know what it was. They didn't know how it happened. They had to take a number of pills. Like, I've heard these stories and they really affected me. And, if you've never heard a story, reach out. There are people out there that love to share their stories and listen to these situations that you could never have expected. And, you'll understand what it is to be like, oh, not me, not me, not me, not me. And guess what? It could be anyone. It does not pick and choose. Yes, you see, not being safe is a red flag. Thank you. Next. I think society in general has made conversations about sex very awkward. Let's change that. We are in a place where now is a time, not just about sex, about things that you hear people say, whether it's sex or whether it's, insulting or bullying. This is the time we stop it. As much as you guys like to nag and, about other things for no reason, maybe it's important to you, and great, let it be important to you. We need to fix society in general. Like, let's talk about sex. Let's talk about positivity. Let's stop slut shaming. Let's stop talking to people like, where some people are single. Let them have sex. As long as let them be safe. Let them be safe. Let them have sex. Let's not make people uncomfortable being who they want to be. You, we, everyone is who they want to be, whether they've grown into their skin, whether they haven't grown into their skin. We need to give them a safe place to want to grow into their skin, whether it has to do with sex, whether it has to do with, how you feel, how you relate. If you want to be something you don't feel you are, like, we need to accept people and stop labeling things altogether, period. All right. So don't label somebody for sleeping with someone every week. Let them. Why is that your business? As long as you're being safe. Safe. All right, let's see. Hello, good morning. All right, let me see. You guys got me really up into this conversation. Let's see, what else do we want to touch? Okay, guys. So we talked about a couple different STIs. We talked about that. And don't forget, we have a couple things here I was going to show you guys. Condoms are number one. You can find condoms at any of the Whitman-Walker health clinics. Come in. They are free. Come and get some condoms. Don't be that scared person who goes into the store and says, I don't want to buy condoms. I don't want someone to see me. But guess what? You're being safe. So who cares if they see you? Buy a box. You could order it online. So you don't even have to go to the store. So don't give me that excuse. Take yourself online. Buy a pack of 100. Don't use them too quickly. But and if you want to, I'm nobody to judge you. So let's go there. We also have the female. So guys, if you forget it, ladies, don't be depending on these men. Let's stop there. So get your female condoms, have them ready. They're very important. If you're ready for something and he's not, guess what? We are. All right, water-based lube. And we also have latex-free condoms. So if you're allergic to latex, don't give me excuses. And the female condoms are insertive, so these go into women. If you've never seen one, Just type in female condom. It'll tell you exactly how they work. You put them inside of your vagina. And then we go ahead and are ready. You're ready. You're ready to get it done. Right? And then tell them, don't call me next day. Just kidding. They can call you back. But again, yes, insertive condoms are truly the best. I might need to try one. But you can also use these for other things, like let's say you don't have a dental dam. You can take out the bottom little plastic and then use it as a oral. All right, so don't think that oral is also, safe. Make sure you get a dental dam. If you don't know what that is, Google it. Dental dam. We have a couple more things here. If you're scared how it's gonna taste, you could use some flavored lube. We got bubblegum blast, cool mint, and strawberry kiwi. Some of you like candy. I know I do. All right, let's see. Thank you. I'm glad you love the education as well. Correct. We can also use the female in the rectum. So don't think these are not multi-use. Women, you can use it in your vagina. Men, in your rectum. Also take out the ring. Or oral sex, also take out the ring, and you can use them as a dental dam. Yes, correct. Female condoms. And we also have little keychains for your pills. For PrEP, if you guys are on PrEP, great. I applaud you. But again, don't let that be a reason you're not playing safe. Safety is the way to go, guys. You don't want to worry about anything but your tax returns for now, right? All right. Let's see what else we got going on. So don't forget, if you didn't get any of the information from earlier, don't forget Whitman-Walker.org is the website. You can always go to the website, reach out to them, email them. They have a phone number. Let me give you guys some times on testing. It's very important you guys know. Whitman-Walker has hours for you guys. For HIV testing, it's a free walk-in service on 1525 14th Street, which is the main clinic. We have options from Monday through Wednesday, 9 to 6 p.m., Tuesdays and Fridays, 9 to 5 p.m., Thursdays, 12:30, 2:30 to 5. I'm sorry, 9 a.m. to 12:30 and 2:30 to 5. All right, we also have the Max Robinson Center, which is on 23 Martin Luther King Jr. Avenue, Southeast, and the Eastern Market Youth Services. So you can get all that information on the website. I don't want to miss anything here. And STI training is also a free walk-in service at the 1525 building, the Max Robinson Center, Eastern Market Youth Services. And if you think you've been exposed or any symptoms of actual STIs, or you're known to an exposure with a partner, the Whitman-Walker offers a free testing and treatment at the Sexual Health Clinic Tuesdays and Thursdays at the 1525 14th Street Northwest, Wednesdays and Fridays at the Robinson Center, 2301 Martin Luther King Jr. Southeast as well. The clinic is entirely volunteer run by physicians. This is why it's very specific. If you're just getting tested for a normal HIV, you want to go to the normal. But if you actually think you've been exposed and you need to see a physician, then we're going to try to go to the actual STI exposure symptom options, which is at the Whitman-Walker office. And again, if you go to the website, you'll be able to see what options you have for that. Let's see. Another question. It keeps going up. Let's go back down. La, 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 la. Okay, we have another question. What kind of stuff does a Whitman-Walker do to help testing? So, you can come in and do a rapid test for sure at the HIV center here. So you want to come in, like I told you earlier, that would be the HIV 1525. They have an office at the Max Robinson Center on Martin Luther King and the Eastern Market Youth Services. So give them a call, go to the website, Whitman-Walker.org, and you can get all the information about testing, what kind of options in testing they do. And, any questions you have, feel free to come on in, call, or ask. And let's see, how can people volunteer with Whitman? For volunteer, check out opportunities on the website. So go to Whitman-Walker.org and go to opportunities option. And if you want to volunteer, come on in, send me a message. I'll get you in touch with people I work with here. But yeah, I'd love, it's a great cause. You get to meet people, help people, get informed, get tested. A lot of people don't even get this information. They don't get to understand how easy it is to get information, be able to talk to people, have people here that are able to answer questions for you. So for sure, Whitman-Walker.org. Okay. Doing great. Thank you. Awesome. Thank you too. Thank you guys for the questions. These are great questions. So a lot of people don't like to ask questions, but you guys are asking for them, and here we are. All right. Anything else, guys? Talk to me. Talk to me about an experience you've had. Something that's happened to you, something that you think, you have questions for. Let's see. Whitman-Walker definitely tried its best to be accessible. Oh, I appreciate that. That's why I love working with Whitman-Walker. I got you, don't worry. All right, let's see what else we got here. So we got some things here. Good questions to ask. And you could be very to the point. You don't have to beat around the bush and try to figure out if you can find out. No, hey, have you ever been, tested for STIs? When was the last time you got tested? Are you okay with condoms? Do you know what dental dams are? Ask these questions, because most of the time, they may not know about other options besides condoms and, pretty much it, or birth control, condoms, things, that are so common. But again, we can't be depending on other people for what's going on in our life. We need to be prepared. You need to be prepared for both situations, any situation. And if not, that little encounter can wait. I mean, we have more than time. Let's see what else. You want to be careful, because some people don't know they get infected, like needles. If someone shared needles, they didn't know it was a shared needle. Tats, drugs, piercings, sometimes we don't know. They might think it's a new needle, but it's not. So a lot of people won't know they're infected until months later. There's a window period to find out if we're infected. So you can still spread something without actually knowing you're infected, right? Let's see if we have another question. Yes. Does the clinic have domestic violence counselors? Let's see. We do. We do have behavioral counseling series, and can also link you to other resources. So please go to the website, contact them, ask whatever it is you need, and they can get you in touch with someone or find somehow information and get you whatever you need. Good questions. And counselors to help through tough times? Yes, same thing. So when you reach the behavioral department, just send them an email and say, hey, this is what I'm looking for. I'm not really sure. Hey, we're all learning. Even people here at Whitman-Walker may not have the answer to your question, but the one thing they're great at is being able to find resources, our resources for you, and, confidential, and they're super helpful to help. And yes, if you have anything, please contact me. I know exactly who to get you in touch with. I have so many great people here that I work with at the Whitman-Walker Clinic. So contact me. I'll get you information. Don't be shy. And, don't even need to get into any conversation with me. Just let me know, hey, I want to reach out to someone at the Whitman-Walker. How can I do that? And I got your back. Of course. Thank you. Oh, let me drink some, because y'all got me parched, all this talking. Sorry, my cup always matches my outfit. Don't judge me. Or actually judge me. All right, let's see. Thank you. Somebody actually sent us here, Whitman-Walker.org, and there's a behavioral. So go ahead and take a screenshot of that if you have any questions for counselors or reaching out information you're not sure about. Oh, thanks. Hey, Soul, we stand and supportive influencer. Beautiful. We are here. We are trying to help, and we're super happy with the Whitman-Walker help. This is the first time that they've actually done a social media influencer. So we're all learning. We're all here to try to reach out to you and make you guys feel comfortable to ask questions. There is no stupid question. Ask a question, even if it's something you feel like, oh, that's a dumb question, ask it. Because it's better to, speak to someone who has more experience than to just sit there and wonder, hey, I don't know, and I'm not going to know because I'm never going to ask. So you guys ask away. Ask, 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 ask. And remember, safer is sexy. Let's see. All right. Any more questions, guys? Y'all got me burning up in here. Where's a fan when you need one? Let's see. Beautiful. Oh, thank you guys for all the waves. I would wave back, but too many. How's it going, Facebook? Facebook's super quiet. But Instagram is. Let's see. NK True. I hear they have programs such as Share, other types of trails for the meds. How do I get involved? All on the website. So go to the website, look up that information. If you can't find it, like I said, just contact Whitman-Walker and they'll put you in touch with whoever you need to be able to join, be a volunteer, get involved. We're definitely here to help, and the more help we get with people who want to get involved, like you guys are asking all this information on how to get involved. Just go to the website, send me a message after I get out of here. I can get any information for you guys. I'll find out. Like I said, I have a great support system here at the Whitman-Walker who helps me, even myself, learn more and be informed and be able to use my platform to get you guys information and to just make sure you guys know that you are not alone. You have people here that care about your safety, care about your well-being, and that want to be there for you. Let's see. Looking good. What you got for me, guys? What else you got? We talked about good questions to ask. Bottom line, guys, STIs are really common. Anyone can get them. So take care of yourself. You are important. You matter. And make sure that we're always available. 2, get informed. Get informed. Something I may have said today that you're not familiar with, Google it. Find information, go to the Whitman-Walker website and find out more information about it, because it might be something that is useful to you that you never knew about, right? But it all starts with what? Conversation. Conversations. We're here. I'm here having a conversation with you guys about learning to talk to people. And imagine me, I'm super shy. So, very shy. You guys know me. Thank you. I appreciate it. And let's see what Whitman-Walker says. Check out the whitmanwalker.org research for more info on pathways to medications and currently enrolling studies. Perfect. Thank you, Whitman-Walker. And don't forget, there's also, you see me posting a lot of like testing and mobile vans out there. Anytime you see that, they're doing, they go to different areas in the city and do testings. That's exactly what we're asking here. I've seen their vans before too. What's the deal with that? Yep, exactly that. They have condoms, they have lube. They give information on, what you need to do, where you can go, your times, but they also do testing. So if you see those vans out, get tested. Hey, you can't beat that. They're trying to come to places where they don't have that option. They don't have somewhere to, say, oh, let me pop into this place and get tested. No, not everyone has access to these locations. So we try to take these vans. So if you know of a place that, an event or a party that, might be interested in having the van, let us know. Send me a message. I'll get you guys in touch with the people I work with. They're super eager to be available anywhere you guys think they don't have many options to get tested, or they don't talk about it, or they don't think about it. At the end of the day, all these situations happen depending on your zip code, wherever you live. Some people don't get the attention they deserve because of life situations. So we need to be very helpful and send things there. That's why the mobile van is a super, super great idea. We're able to help people in places that they don't look for help, or they don't know there is help. And Whitman-Walker is very good at doing that, sending help. We're here to help inform all of us, all humans, not just specific ones. All right? Beautiful. And we also have medical providers on the van that provide HIV, STI testing, STI treatment, PrEP, PEP, starts, blood screenings, and more. So definitely, if you see a van, check them out, ask them questions. Don't be shy. No one's going to judge you. We're not here for judging. We're here to inform and to help you be comfortable with your sexuality, with your sex positive life, with whatever it is you do. That's your business. We're just here to help you make sure you stay informed and safe. Safe is important. That's the word. Confidence comes a long way. So once you're comfortable with yourself, we'll be able to never let someone overpower us and make us make decisions we don't want to do. Okay, let's see. Any more questions, guys? Okay, someone asked, do they have blood pressure screenings too? Yes, they do. So if you want to get your blood pressure screened, get on that van. Make sure it's the right van, okay? Don't just get in any van. All right, let's see. And yes, HIV treatment too for newly diagnosed folks. Correct. Whitman-Walker can get all the information you need. So, it starts with getting tested. Getting tested. Make sure if you are, very sex positive and are out there having sex, get tested. Every 3 to 6 months is a good time frame to get tested. Make sure, contact Whitman-Walker, contact me with any questions. Let's see. Instant linkage to care, yes. All right, it says schedule for the mobile health pop-up van by calling 202-487-0067. So guys, screenshot that number if you're interested to know where the mobile van is popping up. They're usually out every week pretty much. So, and like I said earlier, if you have an event and you think that'd be something to have outside of your event, give them a call. If they can make it happen, they will make it happen. All right? Looking good, guys. I'm loving all the questions and the info. And I love my team. They are on top of it, sending you guys links, helping me with information. And guys, check it out. You can also email at mobilehealth@whitman-walker.org. Can't wait to see you guys. They're excited to meet you, help you guys with any information you guys think you might need. Hit them up. Hit them up. Go get some free stuff. I showed you guys condoms. We got lube, water-based lube. If you're allergic to latex, don't forget there's other options for condoms. Polyurethane. We have flavored for those of you who like candy. Like me, I like candy. I'm taking these, by the way. All right. Let's see. All right. I think I touched all subjects I wanted to touch today. Do you guys have any questions for me? Or anything you think, you want to ask? Yes, very important. Don't forget to follow social media. So you can see I'm with Whitman-Walker right now. So just click on the Whitman-Walker and follow them. They have all the information. They post more than I do. So you'll see me post here and there when they have pop-up events. But I love candy too. But make sure to follow them for, more events, more. I know they're having like an art show going on right now. So go check that out. They have a lot of fun stuff to do. They have like little pop-up gatherings where you get to go meet people. Let's see. When do you get to see me again? Just close your eyes. And dream. Oh, you mean, well, since we are getting started, we're going to get all the social medias on here one time, and then we're going to try to make this more often. So we're going to have, general conversations where we just come on and talk to people. The first couple ones are very lean to our specific subject, but we are going to be here able to just interact with you guys. I know it's great to have someone to talk to and listen and just be able to relate that we are all human and we love each other. So make sure, let them know how much you like this. Go to their page and say, hey, I love the lives. Can we get more of those more often? And guess what? They'll call me and I'll be there. More. Yes, more of these. All right. So any more questions, guys? Oh, thank you, NK. True. And yes, the art show I was just talking about is called When We First Arrived, and it's at 1701 14th Street Northwest at the corner of the Whitman-Walker. So make sure you go on the website and check those dates. I'm going to try to pop in one of these days because I actually want to see what's going on and come hang out with some of my friends. So any of my friends that are on here, let's plan it. Let's go check it out. I think they have it till like March 29th, if I remember correctly, something like that. I'll let you know. I'll get the dates. And let's see. Oh, great, great. Are there going to be chats like this in Spanish? Yes, we can actually definitely do it. Yo hablo español. No, actually I do, but that was my accent. I don't have an accent. But yeah, I'd love to. That's a great idea. I'll let them know, and that'll be awesome. We can definitely get Spanish. Porque bastantes personas no saben inglés y estamos aquí para todos. So definitely we'll try to get some out here in Spanish as soon as possible, so stay tuned. And please, if you guys missed me and were not able to ask a question, please hit me up. If I know it, I'll answer. If I don't, I'll get you in touch with our people, and our people are always here to help. So don't be shy. Send information, send questions, send topics you might want to hear about. Like, let me know what you want to talk about, because the more we interact with each other, the easier it's going to be to help each other. All right. So with that said, thank you guys so much. My name is Orlando Machuca. You already have me on Instagram. If not, follow me, Lando Dolce. Thank you so much. I appreciate you guys spending your afternoon with me. I will see you soon. And later, guys. All right. And